fixing your shoulder to correct your neck pain. Most people out there think that the neck pain comes from just in the neck region. But I'm here to tell you guys that out of the thousands of patients that we fix, oftentimes your shoulders or your upper back muscles and joints are the root cause of your neck pain. Now, of course, there are always exceptions out there of people coming in with disc herniations in their neck or people that have just straight neck pain. But most oftentimes, the mid-back being rounded and pushing your head forward is often the cause of the neck pain. Now, in addition to that, we also have people who come into our office with shoulder/rotator cuff injuries that they have had for weeks, months, or years. People that have had total tears of the labrum or tears of the rotator cuff muscles, or even just basic bursitis in the shoulder. And what happens is that when you have shoulder or rotator cuff pain or injuries chronically, now when we're talking about chronic, we're talking about 3 months or more, right? What that does is that it usually causes the patient to pull the shoulder upward like this, okay? Because they're trying to protect that rotator cuff or that shoulder because it's either inflamed or is so spasm and they're not able to move that arm in a certain movement. And oftentimes when they let the shoulder come downward because of the tears, they oftentimes will have an increase in pain in the rotator cuff. So when that happens, guess what they reflexively do? They automatically bring the shoulder up and pull it in forward. Well, you can imagine if you're doing this for just say 2, 3, 4, 5, 6, 8 months or sometimes 2 or 3 years on and off, what happened to the muscles of your neck? Well, they're gonna get tighter and tighter and tighter, and next thing you know it, you're gonna have a basically compensation of neck pain that is caused from the rotator cuff tears itself that has been going on a chronic level. So what I recommend is go out there, get it checked by a health professional, physical therapists, chiropractors, your orthopedists. Get them to check out your shoulders and make sure that you limit any shoulder compensation to correct your neck pain. Because if you're only going at it and going getting massage, chiropractic work, PT for the neck, I promise you, your neck pain will slowly reoccur again, and you're actually gonna be going through the whole process and the whole treadmill of over and over from shoulder pain causing neck pain and back and forth. So just keep that in mind when you do have neck pain. Thanks for joining us. If you guys have any questions, please let us know, and please subscribe to our channel.